Welcome to the Beyond Face Value Show. I'm Dr. Jill Wade, and it is my honor and pleasure to introduce you to our studio and our new show. I wanted to take today and the opportunity to get to know you and you to know me a little bit better. If you are patients of mine in Frisco at the dental office, of course you know me already, but for those of you who don't, I think it's important that really you get to learn a little bit more about me, the philosophy that I've had in dentistry all these years, and get to know me a little bit better. So the Beyond Face Value Show is really about your mindset, your money, and of course your health and well-being. And so in future episodes, that's what we're going to be talking about. We're going to have guests with us, not only from the dental community and some of our other fine doctors at Stonebriar Smile Design out in Frisco, Texas, but we are also going to have some of our professionals, our doctors that we co-manage patients with, some of our OBGYNs, functional medicine docs, our chiropractors, our ENT specialists, and lots of health and beauty experts. And you never know, we may also throw in some exciting people who don't practice or work in town but can be brought in digitally. And it's just going to make it fun and exciting, and we are just here to explore all kinds of things that can help you in your day-to-day life live your best life, because really isn't that what it's all about, is just you feeling good, aging gracefully, and really making your own decisions, being your own healthcare advocate. That's what I really believe in. So I wanted to share with you kind of how all of this got started in my career itself. And I have been a practicing dentist for almost 26 years, and I love it. I'm super passionate about dentistry. My education was here in Dallas, Texas at Baylor College of Dentistry back then. It's now Texas A&M. For any of you, I kind of laugh and call myself a baggie. And the schooling that we had in Dallas was fantastic. I kind of grew up in the age of dentistry of what they called the golden years of cosmetic dentistry. I was super, super lucky to be in an AEGD program, which was the Advanced Education of General Dentistry program. And in that program, we got to study, learn, and coordinate with all of the other specialties at the school. So it was the oral surgeons, the periodontist, the orthodontist, the pediatric dentist, everybody. And we, as the general dentists, were very much, most of the time, the kind of choir directors of everything. And so in that education after dental school, it was really where I learned how to practice the way that I do. Very functional and very cosmetic, because we always say form follows function. So you can have something that looks really beautiful in somebody's mouth and do all of the cosmetic type of veneers and things that people want, but guess what? It may look beautiful, but if it can't last, is it really valuable to you? Is it worth your investment of doing that if you don't also take into consideration the function of it? Because it's got to chew and it's got to talk and it's got to be able to be used without breaking. And so in our program, we were able to learn both sides of those two things. We learned all of the cosmetic aspects. We learned how to evaluate somebody's face, somebody's smile, somebody's skeletal features, and actually design a smile that not only looked great, but also functioned. So very early on in my career, I was able to go out and practice the same as people who had graduated 15, maybe 20 years ahead of me. And I was able to practice as a new young dentist the same way. This was invaluable to me. And so it really catapulted my whole career in order to be able to think about someone, a patient, about more than just their teeth, more than just the teeth that we were working with, but that there was a person, a real live person that was connected to those teeth, and what they wanted to do with their smile, how they wanted to live, what kind of maybe even finances they had for their work, all of that mattered. So learning how to treatment plan and to present treatment to the patient, not only of what they needed, but also what they wanted. And that is a lot of my philosophy about the dentistry that we practice out at Stonebriar Smile Design. So let's fast forward a little bit. So I started business back in, 1999 in Frisco when it was like 14,000 people. And now there's over 200,000 people. So I've been blessed to be in a community where the patient base and I grew together. Now we have a practice with 4 doctors, and we're able to practice the way that we do because we're very talented at what we do, and we're not like every other dentist on the street corner. So back then, I think it was about 2008 in Frisco, there was a large community of my patient base who was in the IT world. And there was a big boom that busted, and a lot of what I would call that middle to upper class middle community that lived out there were hurting very badly. They lost a lot of jobs. And so therefore, it wasn't about spending extra money in their mouths for cosmetic purposes or anything like that. It was more about really getting down to the basics of exactly what they needed. I like to call it bread and butter dentistry. Both things are important, but bread and butter dentistry really is when I learned to step back and really look at our patients' mouths. I knew these patients. They had been patients for a long time, and so I had seen them in the good times, and now I was kind of seeing them in the bad times. And what I mean by bad times is stressful times. And it was amazing. All of a sudden, I started to see inside the mouth that their mouth did not look the same as it had the 5, 6, 7, 8, 10 years that I'd already been with them. It started to look different. And I was like, that's so strange. How and why would it look different? I know they didn't stop just brushing their teeth. I knew because they were sharing with me the stressful times that they were having with their family, finding a new job, taking on maybe a second job just to make ends meet. And that's when I really stepped back and started to think, what does stress do? What does it do to the body? And what does it do inside of the mouth? This was very eye-opening, and honestly, not something that a lot of people were talking about. It wasn't like I could go pick up this dental book, dental knowledge, pictures and things like that, and just learn about it and figure it out. There was really nobody out there talking about it. So back around that time was also when I had my twin girls. I was very focused on my career for very many years. So I didn't have children until I was 39 years old. And I'm just telling you guys, having children is better on your body when you're a little bit younger and a little bit more able to have some of the extra hormones. And let's just keep it like that. Younger is probably better if you're looking at your overall health and well-being. So I was learning a lot about my body and what my body was doing with all of that new additional stress of having newborns, maybe not sleeping quite as well, and the hormone changes that were happening, not only during the pregnancy, but also after the pregnancy. So I had a very good friend at the time that was a chiropractor who was very, very well versed in females and hormones. And before I had the girls, I had been working with her, and we had really done a lot of very natural supplementation for hormones. And that's how I was feeling really, really good right before I had the children. And then it just slowly but surely started going downhill, right? Well, I realize now, looking back at it, that this is a lot of what happens to a lot of women. And for whatever reason, the typical standard of care and healthcare that's going on in this world right now really just kind of brushes aside all of these symptoms. I don't think it's that anybody doesn't care. Nobody went into the medical profession thinking that they don't care about patients. But stopping and listening and understanding what the person is saying and the symptoms that they have is really important, because the symptoms are really the key of trying to help somebody and actually suggesting and coming up with plans that actually can make you feel better, because nobody wants to feel unlike themselves, or can't lose the weight, or don't have any energy, feeling overwhelmed, all the things that we hear that young mothers talk about. So when all this happened, I decided specifically that I was seeing all of this stress in the mouths of my patients, and that I really wanted to share with them and discuss a lot of these health kind of issues and philosophies. And so I actually wrote a book back in 2012 is when we published it, which means I wrote it right after I was having the girls, because once they went to bed, this is, oddly enough, what relaxed me. And so I would go in and I would write for an hour or two after I put them to bed. And the next thing you know, here comes the Address the Stress book, a relevant guide to the oral systemic link. And really, the reason why I wrote it was for my patients. And I shared this book with my patients and sent it out to all of them. And over the years, that's what really was kind of describing my basic philosophy. And that is what I want to share a little bit with you about today. My philosophy really stems from this. I truly believe that the body is not individual parts and pieces. And the healthcare and the way that we train our medical physicians, our radiologists, our chiropractors, our dentists, even our nurses to some extent, sometimes what happens is we all start to get our blinders on and we only look at a patient with the knowledge that we've been trained in, our scope of practice, and then that's the only lens that we look through. And so what happens is it gets really discombobulated. And so people are only looking at eyes, people are only looking at blood pressure, people are only looking at teeth. And I don't know about you guys, but we are all one part or piece. It is the whole body, the whole machine that makes everything work. Our brain tells everything else to work. So how do you start chopping up and thinking about patients in silos like that? But that is what happens, and that is also why I think it's so hard for a patient to really understand what one type of thing or disease or symptom is influencing something else. And so my basic philosophy talks a lot about the circle of health. And the circle of health is, think of it like a circle. And what we talk about is that if, let's say a tire, like a bicycle tire, if one part or piece of the tire is bruised or low in air or messed up just a little bit, it still may be that you can function and that you can still ride your bike and make that wheel turn, right? But let's say 2 or 3 or maybe 4 things are really starting to get out of whack. And so just envision a tire now that's really wonky and doesn't even really look like a circle anymore. Are you really going to be able to keep going forward? Are you really going to be able to pick up your speed? Or is all of that going to start to slow things down, make your, kind of health or your life kind of bumpy? Absolutely. So when you start to think of somebody as a whole and that parts and pieces may be starting to get sick or starting to get ill, and you start to think of them as symptoms. So the symptoms are where the key is. And if you think about the symptoms, then the symptoms will point you to a system. And the system is like our organs, like our liver or our lungs or our blood or our brain. And so if you can then take your symptoms to point to the system that is out of whack, then guess what starts to happen? You start to pinpoint to the root cause of where the disease is actually coming from. Now think about it. I'm going to say it again. The root cause of what is causing your dis-ease. That is what we should all be focused on, and that's what we should all be thinking about. Because for me personally, in this world, I'm always going to tell you where I think the root cause of what caused the problem is coming from. Because when you take care of that, you really take care of the situation. Sometimes a lot of, let's say, medications or treatments may actually only be a Band-Aid for the symptom, not a cure or a fix for the system that's out of place that's causing the symptom. So in our philosophy, We've actually created our medical history, and I'll go over that in another episode sometime. But that's how we communicate in our office. That's how I communicate with the hygienist. That's how the hygienists communicate with you, the patients. And it's because if we can get down to one of what we call the 4 root cause or kind of main systems of the body, now we kind of get into the thought process of what's happening, what could be the root cause, and what kind of solution can we be talking about. And so again, like I said, we'll be talking about that in some later episodes, but that's my philosophy in total. Now this is where it got really fun. After I wrote the book in 2012, I also got introduced to a group called the Bell-Donene Method. Dr. Bradley Bell and Dr. Amy Donene are fantastic scientists. They take all of the current research and they are so good at being to distribute, kind of read through it, because sometimes it's really hard to understand through the research, like what's really important and what isn't really important, but they're able to do that for us and then help us as practitioners make sure that we understand the takeaways, the important takeaways. And they train both dentists and physicians and specialists all at the same time, because they know, just like my philosophy a few minutes ago that I told you about, that the body is a whole body, not parts and pieces. So you can't just ignore the dental aspects of somebody's health and only focus on the physical signs of it through like a functional medicine doc or concierge doc or a cardiologist or something like that. So when we began to study not only ourselves and our dental practice, and then created our Smile with Heart program and actually practice that way, but also co-manage patients with those cardiologists, chiropractors, OBGYNs, pretty much any specialty you talk about, ophthalmic, everything you can imagine. That's when we really started having some fun. That is when all of the things that we had picked up over the last 15 to 20 years about the subtle differences of what we were seeing in the mouth, in the gums, the tongue, the cheeks, the skeletal features, how the teeth broke down, how people were breathing, what kind of obstructions in the nose were there. This is when we really started to begin to identify the root causes of the problem and then give great suggestions to our patients on not only how to fix the teeth or maybe what was broken or maybe the periodontal disease, but also give great suggestions on how to treat the root cause of the disease. And that's still how we practice today. So why the Beyond Face Value Show? Well, in some of my entrepreneurial groups, I go to several times a year, maybe at least once a quarter. I've always had entrepreneurial groups of mostly women that we get together and we learn so much from each other, even if they're not dentists, different businesses, how they run their businesses, different philosophies. It's super fun. And it seems like every single time I go, something would come up, somebody would ask me a question, some kind of medical question, some kind of dental question, and I would just be talking to them about, what was going on, ask them a few questions. Maybe it was about their kids, maybe it was about their child snoring, maybe they were asking me for a little bit of dental advice. And every time this went on, they would be like, Jill, that's such great information. Like, you've got to share this with people. You've got to tell people more about this. I've never heard this in the way that you talk about things. And actually, it was through them, they encouraged me to start a podcast, to be able to talk to you and to share with the public these types of stories, these types of educational things. And because really the only way that we were able to do it at this point is to help the patients that are actually in the practice. But there's lots of people, there's big country out there, and so we want to be able to share this with you, even if you don't live in Dallas or Frisco. The Beyond Face Value Show. It's about health, it's about wealth, it's about mindset, it's about money, and it's about more, a whole bunch more. But a lot of people ask me, well, how in the world do you talk about health and money at the same time? Well, let me tell you a couple of things. I'm gonna bridge the gap, is a way I like to explain it. So one of the things that I know about stress, and one of the biggest factors that can create stress for a person and for a family, can be financial stress. I've lived through it myself before. And I've been a business owner for a long time, and I've been a single mom for 10 years. So of course I have seen my fair share of stress from a financial standpoint. And what I would love to share with you guys as listeners to the podcast is to explain to you the value of maybe having work done and the investment that you're going to spend versus what is it going to cost you if you don't do something about it, if you don't maybe take a little more proactive approach to your health and be more preventive in nature. Because I'm going to tell you, yes, prevention for your health, for your teeth, or any aspect may cost you a little bit more upfront, but promise you, I see it over and over and over again. If you choose not to do the investment up front, it will cost you more in the long run. And so we're always going to be trying to point that out to you and give you kind of general ideas of what things cost, maybe the value, or maybe some type of lesson in the financial aspect of things. But also as a business owner for many, many years, I have tons of patients, tons of friends that we talk a lot about finances. And as a single mom, like I said, there were years where I was stressed out, like a lot. And all I really ever wanted to do was to be able to bring home another income as if it was a 2-parent income family. And I spent tons of time and effort and tons of money trying to create ideas, businesses, and things that would help me bring in more income to our family because I knew that that was part of the solution. However, what I didn't have is I had some great financial consultants in one area of life, and they are very good at what they do. And at the time, their philosophy on 401k plans and things like that was perfect, and I totally agreed with them. But you don't know what you don't know until you know it. And then when I grew in some of my areas of entrepreneurial friends, I started to hear things about business that I had not heard through the dental community. And when I started to learn more things about just different tax savings and trust and whole life policies to use as infinite banking and things like that, my mind was just blown. And all of a sudden I realized I had the money all the time. I just didn't know what I didn't know, and I wasn't making my money work for me. So when I tell you that the Beyond Face Value Show has something to do with both health and wellness and wealth, that is what I'm talking about. And so that's why throughout the episodes, you're going to hear us on some episodes specifically talk about finances, and some of the people that are going to come in and be guests on our show, that's what we'll be talking about. We will be talking about business, and we'll be talking about finances. So I just am excited that you are beginning this journey with me. It is something I'm excited about, and I hope that you are too. Down the road, we're going to invite you to share this with friends and family, because we truly feel that the way that this whole, word and knowledge is going to be a grassroots effort, and it's going to start with you. Also, to help us grow and expand our reach, be sure to like and subscribe to this show on YouTube or your favorite podcast platforms such as Spotify, Apple Podcasts, or whatever you prefer. Just remember, it's time to live your legacy now. I'm Dr. Jill Wade, and this has been the Beyond Face Value Show. Until next time.